There's many problems in recruiting and retention physicians in rural America, and what I would like to do today is just paint a little bit about the overall problems of accessing health care in rural America, the unique challenges of rural America, and why this particular project is so important.
So let's talk about recruiting and the difficulties of supplying these communities.
I would be glad to. I would like to paint a little bit larger picture of the problem in rural America. 62 million people live in rural America, yet 50 million people live in health professional shortage areas. We often hear about doctor shortages now, especially when we're talking about health care reform. It's always been a problem in rural America. It's primary care shortages and it's general surgeon shortages. I think you're exactly right. If you have that combination in rural America, you pretty much can take care of 90% of the cases and not have to worry about dangerous road conditions or flying patients out during that critical hour. We're talking about 25% of the population live in rural America, yet it's scattered over 90% of the land mass. Overall, this population is older with a higher percentage of chronic disease. Higher rates of diabetes, higher rates of heart disease, basically more difficult cases to treat. And as I said before, provider shortages are pervasive. 25% of the population lives there, yet only 9% of the physicians in America work in rural America and provide health care in rural America. The other problem that you're going to hear about today is that population is aging, just as our population is aging, and just 15 years from now, 20% of the population is going to be 65% or older, yet general surgeons in rural America are retiring at a very rapid age because they are also aging. Recruitment and retention problems are persistent in rural areas. And that's, again, exactly where the shortage exists. Primary care is the greatest demand, but you have to have primary care with that general surgeon combination in order to provide health care. What I'd also like to do is focus a little bit on the general surgeon crisis, which is, of course, what we're here to talk about today. In 1994, there were 7.1 general surgeons per 100,000 people. Today, there are only 5 per 100,000 people. In rural America, the problem is exacerbated. It's much graver. And let's talk about a local example, Maryland. Those of you in the area certainly know that state, certainly know the urban areas, but there's a lot of Maryland that's also rural. A statewide average of general surgeons is 5.2 per 100,000 people. Yet if you go to southern Maryland, the more rural part, there's only 3 per 100,000 people. And as I intimated before, more than half of the general surgeons are older than the age of 50. So we do expect a wave of retirements in the near future, just as the baby boom population is becoming in need of their greatest time of care as they get older. The importance on this, and I'd like to talk about an economic component that we often don't think of about in healthcare, is first of all, it's very critical to have that general surgeon there. Without that, there's so much primary care that cannot occur. It's basically crippled. A family physician, obstetrics are critically important in rural America, yet often without a general surgeon you can't deliver babies, emergency room can't take trauma cases, and most internists have to forego some of the complicated, a little more complicated, yet fairly routine procedures simply because they don't have a surgeon as backup. That cripples the local economy. But let me first give you a quick example, and we heard a lot about some about Montana, but in a small critical access hospital with only 25 beds in Wilcox, Arizona, they recently lost their general surgeon there. Now emergency cases have to be flown by helicopter 82 miles away to Tucson. That's a cost of $14,000 per air trip. And they have to do about 10 of those air transports each month. It doesn't make any cost-effective sense at all to lose the general surgeon. Let's talk about the important economic impact and how important healthcare is to that local economy. The recession, we hear a lot about how it has hit urban areas. Job losses and the uninsured and underinsured are actually even more acute in rural America. As those manufacturing jobs leaves, the one area that is growing in rural America is the healthcare industry. Usually it's the hospital or the local school that is the number one job creator in the area. In fact, if you put one physician in a rural America, that can create 23 ancillary jobs, which is, and a local hospital can provide as much as 20% of the local economy. So not only is filling this tremendous gap in rural America, this link with primary care and the general surgeon, absolutely critical for the patients, it's also absolutely critical for the local rural economy.